Hey, what's up? This your boy BJ the DJ. And today on the show, I'm going to talk about my story as it pertains to having to get a mammogram because of a situation that was in my life. But anyway, in the studio right now, I have Dr. GC, and that stands for Dr. Katherine Glover-Collins. She's the assistant professor of surgery over at Washington University. How you doing today?
I'm doing well. Thank you for having me.
Yeah. So how about I start off with how I actually met you?
Okay.
Because I know people are like, BJ's telling the story. I'm like, yeah. So here's the deal. In February of 2019, I was at home, sitting in my bed, now laying in my bed, and I got up, went to the restroom, and I felt what I thought was a hair bump. Mm-hmm. Didn't trip off of it, like, oh, just a hair bump. And then maybe around July, same thing happened, got up, went to the restroom, and felt it, thinking hair bump. Mm-hmm. Didn't even trip off whether it was the same hair bump or not, right? So fast forward, we get to November 2019. Yeah, it was like November. Yeah, October. Late October. It was, matter of fact, it was after we had did our Sista Strut. And so what happened was, I woke up that morning, big knot on my chest. Mm-hmm. And I hit my wife and said, sweetie, I need you to feel this. And she said, boy, you better get away from me. I'm trying to sleep. I said, sweetheart, I'm not trying to get you to feel anything else. I need you to feel something. And she was, oh my God, whatever. So as she felt my chest, I've never seen my wife get scared. Never in a million years. I mean, she might freak out, but never that scared, like something is, really wrong. So once I did that, she said, what is it? I said, I don't know. I have no clue. I don't know what this is. And she said, well, you need to go to your doctor. So I went to the doctor. Doctor said you have to have a mammogram because for the first time ever, I've been going to the doctor since the 80s. Mm-hmm. She has never did a breast exam on me. So that was a totally different exam that she did. So then I went, they said you have to go to the 4th floor over in the Highlands. Okay. I went over there, went to the 4th floor to get a mammogram, and the lady said, I can't do the mammogram on you. And I said, why? She said, because you have to have a diagnostic mammogram. And I was like, I've never, ever in my life heard of a diagnostic mammogram. So then I went to book the mammogram at Siteman. Mm-hmm. It took me about a month to get there. Went over to Siteman, and it was weird because they put me in this room and all with my wife, and all these ladies had on these pink, what do they call?
Gowns, yeah.
Pink gowns. So they had on the pink gowns. And then when I was sitting there, a lady came and she said, excuse me, what are you here for? I said, I'm here for a mammogram. So she looked at me kind of weird, walked away. I guess she had to go check it out. I guess I didn't look the part, I guess. And so I said, okay. So I get there. I go in the room. They have me to do the mammogram, right? So, of course, I'm laughing because I ain't got no extension. So, I just got nothing at all. So then it was funny because the machine found something to squeeze on. And I didn't know how because it was like, I got nothing here, right? And so I'm on the inside, I'm laughing because I'm going, this is really weird. Mm-hmm. So then they come back, they say, everything looks good. And then it was that word, but. Mm-hmm. They was like, we got to be sure. We need to do an ultrasound. So I did the ultrasound, did that, and then the next thing you know, they go, everything on the ultrasound looked good, but, and I was like, what? And then we got to do a biopsy. So in January 2020 is when I had the biopsy. So they did the biopsy, and then it came back. They were saying, well, you know what? Everything's good. You don't have cancer. I said, okay, fine. And then in March of 2020, March 13th, I came to see you.
Mm-hmm.
And I remember this clearly because I was drugged up, right? I'm drugged up, and I go, yeah, so we gonna have to get together because I got to tell the world about this. And I was like, because I work for iHeart, and I was just, I don't know what the world I was saying because I'm still drugged up. You probably remember. So when I told you that I was going to tell the world about this surgery that I had that you did,
Mm-hmm.
what was your first thought?
So I guess my first thought was I get to meet the guy that's the voice of Sista Strut, because that was the first thing you told me.
Really?
Yeah,
okay. I didn't remember that.
It was. And so I was actually really excited because Sista Strut does such a phenomenal thing for women and raising awareness about breast cancer and the importance of screening mammograms and everything, that I was really excited to be a part of, or the prospect of being a part of such a phenomenal event.
Yeah, because you kind of looked at me strange when I said it.
Yeah.
You had that strange look. I was like, she probably don't even believe me. But I'm the voice, whatever I said. I don't even know. I was drugged up. I just got out of surgery.
Yeah.
Yeah, and you were telling me all the stuff that I couldn't remember. But but anyway, let's talk a little bit about you. So I had to go through the surgery, but what is your position and what do you do over at Washington University?
So my technical title is Assistant Professor of Surgery. I work in the section of surgical oncology, so that means I take care of cancer cases with surgical procedures. I deal specifically with diseases of the breast, both benign or non-cancerous and cancerous lesions.
All right. So, during the surgery, can you kind of explain what my surgery was?
So you had what is technically called a lumpectomy because we only took the mass out of your chest.
Wait a minute. Hold on. I had a what?
A lumpectomy, or also known as a partial mastectomy. And what we did was the lesion that you had was actually growing in your skin. And the reason why we took it out, other than the fact that you didn't want it there, was that it would probably continue to grow and become locally destructive or mess up your chest. So by removing it, we were trying to halt the process. It was an outpatient procedure, so you were able to go home on the same day. And our pathology came back benign, just like the initial biopsy that you had.
Oh, wow. I didn't know I had a lump. What is it called?
Lumpectomy.
Lumpectomy. Because I heard of that in women.
Mm-hmm.
Okay, so how did can you kind of explain how a man can have a lumpectomy?
Well, men have breast tissue, some more than others. And whenever we remove part of that tissue, that's technically called a lumpectomy.
Okay, all right. So surgery went well, right? And I know that you had said, you said something to me that you had, the scar was going to be a little bit longer than what it was because it was something else you had to do or something.
So anytime we remove something from the body, the scar is usually 3 times as long as it is wide. And that's so that we can close your skin up without there being a lot of tension and the risk of the incision coming apart. So that's why, sometimes people are like, well, my it was only about the size of an eraser. Why is my scar so long? It's got to be longer than it is wide so that you'll heal properly.
Okay, so earlier you talked about you dealing with stuff as it pertains to cancer. Can you talk about some of the surgeries you've had to do over the years?
So since I've been in St. Louis, I came here to learn specifically how to do breast surgery. And I specialize in operations on the breast, which include total removal of the breast, which is a mastectomy. And there are various levels of that. I do partial mastectomies or lumpectomies, where we just remove masses or skin lesions off of the breast. And then I also remove cancers from lymph nodes in the armpit.
So you deal with patients who actually have cancer, and you have to remove that.
Yes.
And so I'm pretty sure that's a pretty intense surgery.
It can be at times, because it's a very technical procedure, and we recognize that if we don't do a good job, then we leave you at risk for having an unfavorable outcome. So we want to make sure we do a good job every time.
Okay. Now, back to me. So why was it important for me? I think you said earlier that it could, mess up my chest. How could that have happened? I mean, you know what I'm saying? Because I'm just looking at it like it was just a lump, and I just didn't want it in.
Yeah. So typically what we tend to use as criteria as to when we should remove something is it causing problems, pain, or is it growing quickly? And in your case, it was actually kind of growing quickly, because it was just a little hair bump and then it continued to grow. So something that's growing quickly will oftentimes, if it's not growing in diameter, it could grow into your chest wall, grow out of the skin, and cause problems that way.
See, like for me, I was just happy that I didn't have cancer. I didn't really get a chance to really talk to you about, the severity of my surgery. You know what I mean? Because I was thinking, I just got a lump removed. I moved on. But one of the things that I did recognize in that moment is that the waiting to find out if I had cancer was worse than when I found out what it was. You know what I mean?
Yeah.
My mental was just jacked up. So women that are listening right now, listen, I get it, because I kind of understand why women will probably shy away from having a mammogram, because they don't want to sit in that way in the unknown period. So how important, though, is it for women to do breast exams and to get their mammograms?
So in terms of doing breast exams, it's important because you get to know what your breasts feel like, so that when there's a change, you can seek medical attention. Just like you were like, oh, there's a little bump there. Didn't know when it happened, but you noticed the change. And then as time went on, you noticed that the change wasn't going away. And so that's what led you to seek help. So doing the breast exams helps you to know when there's a change so that you can seek help immediately. The mammograms are important because they help us find things before they get a chance to present as a problem. So if we find a cancer while it's just a calcium spot on your mammogram, that means it's probably an early stage cancer, and we have our biggest chance of beating it when it's in early stages. So if we can detect it before it becomes a problem or a symptom, then that's much better.
All right. Now, okay. So we're going to start learning a little bit about you.
Okay.
All right. So born and raised?
Born in Massachusetts, but raised in Pine Bluff, Arkansas. And then I went to undergrad in New Orleans at Xavier University. Did my medical training at Meharry Medical College. That's where I got both my MD and my PhD. PhD is in cancer biology, ironically enough, looking at breast cancer and the gene that causes breast cancer, the BRCA1 gene. Then I did my surgical training in the University of Arkansas for Medical Sciences in Little Rock. And then I came here for fellowship in breast surgery, and that's where I stayed.
Oh, okay. Yeah, now, the funniest thing about this was that you did the surgery on me in 2020, and then last year, 2022, almost about 2 years later, we were at an event. and I was the MC. And I have to admit, I saw your name, saw your picture, didn't even pay attention to it because I was in my zone. But it didn't hit me who you were until you walked up on the stage. And it was one of those moments where I was going, wait a minute, really? Really? For real? Really? For real?
Yeah.
And she was like, yeah, it's me. I was like, you guys aren't going to believe this because I had just told my story. And when I told my story, the crowd was like, whoa, and then it was one of those moments where it hit everybody when I turned to the audience and I said, this is the lady that did my surgery. And they couldn't believe it. And I said, I haven't seen her in 2 years.
Yeah.
So how was that for you?
It was really something because it was like I've always felt like God has moved me in everything that I've done, and He was bringing us full circle so that you can make good on your promise to have me on your show.
Yeah, I did, because I did promise to that. I did. I was like, I'm gonna get you on and get you on. I know probably along the way he was like, no, he's not. No, he's not. No, he's not. But like you said, everything happened in a season. God knows what He's doing, and I thank God for you being here today. Dr. I call her Dr. GC, from Washington University. Thank you for being who you were in that moment in my life, because it was a very, very, I might not have shown it that day when I was there, but I was literally freaking out. I was freaking out, but it's just you just being who you were in that moment just made me feel very, very comfortable that you guys were going to put me out. And I had no way of knowing what was going to happen. You know what I mean? And I just took my whole life. I put it in God's hand, but God sent you, so it was in your hand. So I tell people she saved my life. But anyway, thank you for being you in that moment, and thank you for being a doctor you are, for the community and making sure that women and men are being taken care of. You've saved a lot of lives, and you really just made me feel good before the surgery and after the surgery with some of the things you were saying when you just kind of explained to me what had happened and how long it would take and to put, I think you said cocoa butter or something, put it on my scar so I can make sure that it didn't lump up and stuff like that. I did everything you said, too.
Excellent. Well, I hope you had a great outcome, and we can barely see that scar now.
Yeah, you barely see it. Barely see it. But anyway, Dr. Katherine Glover-Collins, assistant professor of surgery over at Washington University. Thank you so much. And then our Sista Strut Breast Cancer Walk is going on in downtown St. Louis, going to be happening October 7th. We're looking for everybody to register. We're trying to get 6,000 people on our registration this year. So go to the website, sistastrutstl.com, and just for a way of us getting together, we are going to do what is known as the Tamia slide this year. The Come Dance With Me. We're going to have everybody do that slide. Last year we did the wobble. This year we're going to do the Tamia, and we're looking for all of you to come on out on October 7th as we bring awareness to how breast cancer is affecting women in the African-American community. Now, I told my story because men, you can get cancer too. And I know a man personally who did have breast cancer, and he's a breast cancer survivor. So, Dr. GC, anything you want to say before we wrap up?
I just want to say that your story is not uncommon. And the one thing that I want people to understand is that cancer hardly ever hurts. So if you're waiting for it to be painful before you get treatment, don't, because it might be too late. So when you notice something different, a bump, some discharge, some skin changes, get in to be seen, because I'd much rather tell you, oh, it's nothing, than to say, if we had saw you 6 months ago, we might have been able to do something.
Yeah, well, thank you guys for everything you do over at Washington University. And again, thank you for being who you are. I appreciate you.
My pleasure.